Fentanyl is a crisis we've been telling you a lot about lately. And today on National Fentanyl Awareness Day, some doctors are shining a spotlight on medication treatments.
Yeah, they hope this will help people in their recovery. CBS 58's Adam Reif live in studio now to explain why they can be safer and more effective than detox. Adam?
Well, when someone uses opioids like fentanyl for a long time, the brain gets used to it and goes haywire if it doesn't get it. At the peak of withdrawal, there can be uncontrolled nausea, vomiting, and diarrhea. So people are very motivated to use opioids and avoid those symptoms. But some medications bind to the brain in the same place in the brain that heroin and fentanyl bind, and thus keep people from going into withdrawal.
People are already using substances in your neighborhood.
200 Americans are dying every day from fentanyl in a crisis that is not stopping. Dr. Hillary Tamar sees patients from every walk of life and says there are friends and neighbors.
The faces of opioid use disorder are many and varied.
The predominant treatment was behavioral health, but medications that treat opioid use disorder are effective on their own and keep people from getting sick.
You get your methadone, you don't go into withdrawal, you don't feel high, you're not drowsy, and then you just go the whole day.
Both Suboxone and methadone are on the World Health Organization's list of essential medications, and people on methadone are 70% less likely to die of an overdose. Dr. Tamar said generally the longer someone is on medication, the better, because it takes time to build a sober life. But everyone is different.
The research shows us that the evidence is strongest for people that are on methadone for 3+ years, and that anything under a year or less is not effective.
But people who are prescribed methadone must take their dose every day, so access to treatment centers is critical. Fewer centers means recovery is much more challenging.
By far the best, most compassionate thing that we could do for the people in our community that use opioids is to treat them with kindness and to facilitate the opening of more treatment centers.
Community Medical Services internal data shows anxiety is cut in half after 1 month of treatment, and the likelihood of homelessness decreases by 1/3.
There are lots of wins. Like if people are using less fentanyl than they were before, they're often able to attain housing. They're able to provide for their families.
Dr. Tamar said the medication keeps people from withdrawal so they can focus on other aspects of life, as one patient recently told her.
And he said, since I am on the methadone, I don't think about using anymore, and I don't have to do side quests all day to figure out how to get heroin.
Now, just last week, the City of Milwaukee's Board of Zoning Appeals approved another treatment center on the city's south side, and we have linked to that story in this one on our website at CBS58.com. Here in the studio, Adam Reif, CBS 58 News.
Hopefully make it